I'm Steve Flock, CEO and founder of Celo. I grew up in a healthcare family. My dad's a GP, my sister's a doctor, and I married a doctor. When I first met Jess, our co-founder, she was working as a junior doctor in a very busy hospital. Her and her colleagues would often turn to tools like texting, WhatsApp, or even email to communicate about their patients. It was really for just a lack of alternatives that there wasn't a safer way to do this. So we created Celo. Celo is a HIPAA-compliant and healthcare-accredited communication platform designed to make communicating about patient care simple and easy. Our HIPAA-compliant app helps teams communicate more efficiently, helps capture patient information safely, and even helps capture clinical photos in a way that can be shared with care teams for advice and support. Our platform is now used across the world. With customers in Australia, New Zealand, Europe, and the US, we've seen our platform engagement at an all-time high.
I'm Jack, Chief Growth Officer at Celo. I'm running our US operations and sales, and am based in Seattle. We've recently launched in the US because of the highly regulated market, and in our case, a big emphasis on HIPAA compliance. I've been really impressed with how receptive the US market has been to Celo and how quickly that's happened. This shows the need for Celo in the US market and shows there aren't any solutions out there that really fully meet customer requirements.
Some people may ask, well, why can't I text or why can't I WhatsApp patient information? Texting sends everything in plain text and is completely accessible by your telecommunications provider. WhatsApp, owned by Facebook, looks after data from point A to point B, but once it lands on the user's mobile device and you lose that device, it's easy for someone to pick that up and then walk away with that information. Not exactly a great way of looking after patient information. We work closely with our end users and clinical customers to make sure that we innovate and rapidly respond to customer feedback and keep evolving our product.
My name is Wei, Head of Engineering at Celo. We love to stay nimble and humble. We'd like to keep it that way even we grow bigger. Our engineering process is very agile and outcome focused. Our goal is to deliver value to the clinical professionals as fast as possible and listening to their feedbacks so that we can iteratively improve our products.
A recent example of this was we had a customer find us online to replace some of their consumer tools being used. We had their entire 500 user organization up and running within a week.
Healthcare professionals are busy enough. That's why we created Celo to be easy to use so they can get started straight away with little to no training. Its intuitive look and feel feels just like a consumer messaging app that they're used to, but they can rest assured that Celo's looked after all the healthcare compliance requirements and they can get on with their job, which is looking after their patient.